Dasman Diabetes Institute, an affiliate of the Kuwait Foundation for the Advancement of Sciences and the International Centre for Migration, Health and Development, a World Health Organization collaborating centre, concluded a two-day meeting on diabetes and tuberculosis, or TB. The meeting addressed the global and regional epidemiology of the problem, implications for early diagnosis and treatment, and the need for new approaches, gathered specialists from more than 60 health professions from China, Qatar, the United Kingdom, the United States and Kuwait. The meeting shed light on the growing evidence of the link between diabetes and TB and how quickly non-communicable and communicable diseases may interact and evolve into more complex disease permeations. Sarah Glab has more in this report.
Dasman Diabetes Institute, or DDI, joined the International Centre for Migration, Health and Development to hold the first international technical meeting entitled Diabetes and Tuberculosis, Preventing and Managing a Double Burden.
We've discussed the evidence around the association between TB and diabetes and the implications that it might have for screening, particularly screening at a population level. So it's now well established that diabetes increases the risk of TB by about threefold, so you're 3 times more likely to get tuberculosis disease if you have diabetes. And having TB, tuberculosis may also increase the risk of diabetes. So there's a strong association between these two diseases. And diabetes prevalence is high in this region and it's increasing generally across the world. And there are concerns that this might undermine efforts to control tuberculosis because the increase of diabetes prevalence may be driving more TB disease.
Over 350 million people worldwide are living with diabetes, and Kuwait is one of the 10 most affected countries. Tuberculosis is also rapidly emerging, and the World Health Organization has declared the situation a global emergency, appealing to governments to take action.
It's been fantastic. Everybody is really enthusiastic about the worlds of TB and diabetes, talking to each other and getting together and really trying to make real efforts to control both of these diseases, and hopefully that will carry on beyond this meeting. Yes, I think one of the really key things that's coming out is that tuberculosis specialists and diabetes specialists need to interact with each other and communicate and work out the best way of working together to control both diabetes and tuberculosis, and I think that's really important.
I've been a participant with Dasman Center and Friends of Dasman for the last few years, one of the excellence center not only in Kuwait, in the Middle East, and of course we have to recognize the leadership of Dasman Center, Dr. Kadem Behbahani and his dynamic team that really keep us on our toes professionally with continuing education and development. And today's really update and continuing education from morning till the afternoon has been amazing in collaboration with International Center for Migration, Health and Development. And the center of the discussion of today's workshops have been with the TB and diabetes, and there has been lots of studies, clinical studies worldwide, in the States, in the Far East, even in the Gulf, in collaboration with WHO and various excellent centers, that it is so essential for clinicians and multidisciplinary team for diabetes to really concentrate on the great risk of those patients having TB or developing TB.
In light of the seriousness of the emerging situation, the experts attending the meeting recommended that DDI and the Ministry of Health should help develop guidelines and standard operating procedures to develop new and common strategies to fight these diseases. Dasman Diabetes Institute has collaborated with the International Centre for Migration, Health and Development to organize the first international meeting that focuses on the correlation between tuberculosis and diabetes in the Gulf region, in an effort to raise awareness on the various steps and procedures that need to be taken. From Dasman Diabetes Institute, this is Sarah Gleb reporting for English News.